First of all, none of us is happy to talk about unpleasant subjects, so we always postpone them.
I think there are misperceptions around the role and ability of the state to provide coverage.
At the same time, we are living longer.
There are increasing levels of disability.
The global financial crisis has had also an impact in creating more stress, more debt.
And a health system that needs to catch up in the developing world with the burgeoning middle class.
All of these are converging to a higher rate of the income protection gap, and it is generally underestimated, and so it is growing actually.
Zurich defines the income protection gap as the imbalance between a household's public and private protection against income interruption, be that through disability or death of the breadwinner, and the actual need for those solutions.
It's very likely that a quarter of us at one point or another in their working lives will be subject to a loss of income due to disability.
If individuals have a gap between what their income is covered for and what they actually need, they're going to either dip into savings, they're going to reduce their pension contributions, they're going to rely on the state for benefits, or a combination of all three. And that is going to have an impact on their quality of life, potentially at the time of the event, but also because people are living longer, it's also going to have an impact as they get older and as they age.
We would like to lead a wider conversation, a wider public debate on this issue, because we feel it's of such an importance to both individuals and governments.
This is one of those problems that is probably too big for the public and the private sector to solve on their own. I think it needs to be a collaboration between the public and private sectors. But I don't think the solution is necessarily to say chuck money at it. I think that it is a case of changing behaviours as much as anything else.
There's never a good time to face an increased or a new expense. That's why solutions have to be crafted in a way to be effective, yes, but at the same time also cost effective. If my employer wants to be perceived as an employer of choice, isn't it better if it provides me with adequate protection?
People are asking, what is it that this company can do for me? Will it look after me and my family? What's its value to society? Does it care about my welfare?
I've been focusing on protection issues, protection-related issues throughout my 25-year insurance career. So this is something that I think I know relatively well and I care about. And in addition, within Zurich, thanks to the global reach and thanks to the expertise in this field, we are actually well positioned to be a solution provider for the income gap.